Do you guys know what is quality control? Quality control is a part of quality management system to ensure productions of quality products and safety to recipients. There are few steps quality control in blood banking, which are there are 4 types of quality control for antibody screening. Quality control of blood group reagent. A series of quality control samples should be run at the beginning and end of each test run. Make sure all of the antisera and other reagents are checked daily for their specificity and avidity. Quality control of anti-human globulin (AHG). The reagent should be tested with IgG with coated and non-coated red blood cells respectively. There are 3 types of AHG control testing, which are addition of IgG sensitized cells, positive and negative control testing, addition of IgG sensitized cells known as AHG testing in both macroscopically and microscopically. There are 2 types of tests. First, control AHG serum was added to test. Second, make sure no unbound protein left behind which would neutralize the AHG serum. Positive control ensured by reactivity of antibody IgG serum. It tests by a weak IgG antibody D incubated with D positive cells and tests in parallel with AHG tests. Result of addition AHG serum must be positive. Negative control ensured by the specificity of NGH, which does not contain unwanted antibodies. The test must be negative and is shown as non-agglutination.
Now let's move to the quality control in screening cells. Screening cells are group O cells collected from 2 or 3 individual donors used to detect antibodies. These O cells must contain the following antigens before it can be used as screening cells. The antigens are: in order to detect the clinically significant antibodies, the most common clinically significant antigen should be present on the red cell. As many as possible homozygous antigens present on the red cells are preferred. This is because a double dose of antigen will have stronger reaction, and this can be used to detect weaker antibodies. Screening cells will be expired in 4 weeks. So after 4 weeks, we need to use a new set of screening cells. Here is the example of antibody screen. We can see that we use 2 sets of cells, which are R1, R1 and also R2, R2. So the antigen we detected are RH, MNS, P1, Lewis, Gal, Duffy and also KIT.
Usually, panel cells is used for antibody identification. An antibody panel usually includes at least 10 panel cells. And quality control are not done for panel cells because it's come from manufacturer. For quality control of panels to be performed, information from the manufacturer is needed. For example, panel cells product from phenocell. Phenocell red blood cell reagent consists of 10 3 ml vials of group O human red cell suspension and from individual donor and are not full or frozen. An incorrect reaction may occur due to failure to comply with the recommended procedure. Second is variation in time and temperature of incubation, centrifuge speed, and reaction reading methods. Contamination of test sample, reagent or supplementary materials. The 4th one is use of aged or expired sample or reagents, and the 5th one is incorrect red blood cell suspension strength.
Next, we move on to the precaution steps. First, read and follow the principle or protocol given by the manufacturer company. Second, we need to label the reagent. Third, store the reagent at 2 to 8 degrees Celsius. Remember, do not freeze the reagent. Fourth, check the expired date. Reagent that approach expired date should be used before using further expiring date, and do not use the reagent after the expiry date. And the last one is biosafety. Follow all the biosafety procedure to prevent transmission of infection.